So next we are going to talk about denture care and oral care. With denture care, your clients are typically going to have their dentures in a little container like so. You're going to use a warm water to fill this up and an Alka-Seltzer tablet to soak overnight. We soak the teeth overnight and we brush them in the morning. Typically, our clients are going to have a fancier denture brush that's going to be double-sided. This way, the smaller side can really get into the part that's adhering into their gums and clean off any of that residue that's in there. And it can also work as a nice little pick to get into those grooves. It's a different type of bristles than most toothbrushes, so you want to use this one instead of an average Joe toothbrush. With oral care, we're going to see, toothbrushes, or we're going to see these pink swabs. These are like a little sponge at the end of a popsicle stick. You're going to get this wet in some water, squeeze it out just a little bit so it's nice and moist, and use it to trace along the inside of your client's mouth, help keep it nice and moistened. Typically, this is really going to be popular for our hospice clients who maybe aren't eating or drinking anymore, help keep them nice and comfortable and keep that mouth nice and moistened. But we are going to go ahead and get Sally's dentures in for her. So again, they'll soak overnight and then you'll brush them in the morning. With your dentures, be super, super careful with them. They are very breakable. And some insurance companies will pay for one set every 10 years. So making sure we're being careful with these is definitely key. You'll have your client open their mouth nice and wide, and you are going to easily slide them in. And I like to put pressure back towards the canines and really smooth out along top and make sure they feel good. Your clients will typically move their mouth around and pop them into a good space for them as well. Let's see if your bottoms are easier now that your tops are in. All right. Again, you're going to have your client open their mouth nice and wide. It does help if they're able to tilt their chin back up a little bit for you. Sally does not want to work with me today. Once you have it lined up, you're good to help push back. And again, your clients are typically going to move their mouth around and pop those into place better.